Yersinia pestis is a gram-negative, rod-shaped Coccobacillus anaerobic bacterium that is known for causing the pneumonic, bubonic, and septicemic plagues.
Let's explore its origins. Alexandre Yersin discovered the pathogen in 1894 during the plague epidemic in Hong Kong. It was responsible for demolishing populations during the Justinian Plague, Black Death, and Modern Plague.
The Justinian Plague was the first recorded pandemic. It began in 541 AD and lasted 200 years, killing over 25 million people in the Mediterranean basin. The Black Death, otherwise known as the Great Plague, was the second pandemic. It originated in China in 1334 and spread along the great trade routes to Constantinople and then to Europe, where it killed about 2/3 of the European population. The Modern Plague was the third pandemic. It began in China in the 1860s and appeared in Hong Kong by 1894, the year in which Yersin discovered the pathogen. It killed about 10 million people.
These diagrams show reported plague cases in modern times. For untreated victims of the plague, mortality rates are 50% for the bubonic plague, 100% for the septicemic plague, and 100% for the pneumonic plague. If the pneumonic plague is untreated, death occurs within 24 hours.
So Hannah, what is the mode of transmission?
I'll tell you in song. Ooh, fleas on rats, fleas on rats. Ooh, fleas on rats, fleas on rats.
Yersinia pestis is most often transmitted by the bite of an infected flea. The fleas are often found on rodents such as rats and mice, and seek out other prey when their rodent hosts die. Also, humans can become infected when handling tissue or body fluids of a plague-infected animal.
In all three forms of the plague, patients develop fever, headache, chills, and weakness as symptoms. Unique to the bubonic plague are buboes, which form at lymph nodes. Unique to the septicemic plague are abdominal pain, blood clotting issues, and gangrene. Skin and other tissues may turn black and die, especially on fingers, toes, and the nose. For the pneumonic plague, patients experience coughing, bloody sputum, shortness of breath, and chest pain.
The most common sign of bubonic plague is the rapid development of a swollen and painful lymph gland called bubo. A known flea bite or the presence of a bubo may help a doctor to consider plague as a cause of the illness. In many cases, particularly in septicemic and pneumonic plague, there are no obvious signs that indicate plague. Diagnosis is made by taking samples from the patient, especially blood, or part of a swollen lymph gland, and submitting them for laboratory testing. Once plague has been identified as a possible cause of the illness, appropriate treatment should begin immediately.
Because Yersinia pestis is bacterium, the plague is treatable with commonly available antibiotics. The earlier a patient seeks medical care and receives treatment that is appropriate for plague, the better their chances are of a full recovery. Welcome to Alexa and Hannah's Guide to Plague Prevention.
Step 1. Reduce rodent habitat around your home, workplace, and recreational areas.
Step 2. Wear gloves if you are handling or skinning potentially infected animals.
Step 3. Use repellent if you think you could be exposed to rodent fleas during activities.
Step 4. Keep fleas off your pets by applying flea control products.